EZbra is an all-in-one disposable breast dressing designed to meet post-op requirements for patients and healthcare professionals. Immediately post-op, open the pack, take EZbra out, unfold it, and place EZbra flat on a stretcher. Transfer the patient to the stretcher, ensuring EZbra is already positioned to the correct height under the patient's armpits. Please be cautious not to use EZbra to pull the weight of the patient. To apply EZbra, pull device upwards while slightly stretching the back part. Fasten the tabs by attaching each to the opposite cup. EZbra allows a customized adjustment to post-op requirements, offering a tailored dressing to each patient's shape, size, and post-op challenges. The next step is to open both folded flex bands and attach it to fit the desired compression. Adjust the longer flex bands, tightening each side, above and below the breast, to the desired amount support and definition of the breast folds. The upper band can be used as a bandeau to help fixate implants. Repeat the action in the opposite direction. EZbra can also be used in extreme cases of asymmetry, providing compression to only one side. Once EZbra is applied, you can always increase or decrease the amount of compression by adjusting the tabs and flex bands. The height of EZbra was designed to cover most drain exits. The flex band's Velcro brand fastener can also be used to secure the drain tube, reducing incidents of pain from the drain moving. The lower strap can be used to secure the drain bulbs, providing the patient an all-in-one feminine solution that allows patients to recover with dignity.